Okay. Hi there, I'm Devin Carroll, board certified podiatrist at 1 Foot 2 Foot. Today I want to talk to you about the difference between Achilles tendonitis and plantar fasciitis. Although they are very similar, they do have some differences that we can discuss today. The Achilles tendon is going to connect the calf muscle to the heel bone. We call this heel bone the calcaneus. And sometimes when the calf muscle gets very tight, it starts to pull on this heel bone or the insertion of the calcaneus, which makes it become very painful and inflamed. The plantar fascia is different. It's not at the back of the heel, but it's at the bottom of the heel. And it goes from the front of the foot all the way to the back and bottom of the calcaneus. And there are a few fibers that connect in between this fascia and tendon, which is why sometimes when the bottom of your heel hurts, the back of your heel will hurt. So even though one is a fascia and one is a tendon, they can both become inflamed at the insertion of the calcaneus. And the treatment for them is very similar. First, we start with stretching exercises, because if you got a tight calf muscle, that's going to cause a tight Achilles, which is going to affect the plantar fascia. So usually we start people and patients off with a very good stretching regimen to do at home. Anti-inflammatories like Motrin, ibuprofen, Aleve are all very good at decreasing the inflammation of both the Achilles tendon insertion and the plantar fascia insertion. In addition to that, sometimes icing can help. Rolling a frozen water bottle on the bottom of your foot will do wonders. But if that fails, sometimes at the bottom of the foot, a plantar fascia injection is warranted. We don't usually inject the Achilles tendon insertion because it doesn't have that protective layer protecting the tendon. And so it's more prone to rupture, which is why we avoid injections in the Achilles tendon. Although the plantar fascia is a very good place to have an injection if stretching and home exercises fail to provide relief. Most importantly, arch support is usually prescribed, either over the counter or custom arch support. Because when you support the plantar fascia, this is going to prevent it from pulling so tight at the heel insertion. On the rare occasion, almost never, surgery is recommended for plantar fascia that is persistent for 6 to 8 to 10 months, and we've tried everything. And same with the Achilles tendon, although surgery is sometimes indicated after about 6 months if the conservative therapy does not provide significant relief of the inflamed tendon. And there you have it. That's the difference between Achilles tendonitis and plantar fasciitis.